Hi everybody, my name's Vassallo and I'm from Rhythm Massage Development and Education. In this episode of Connect, what I wanted to mention to you or get you thinking about is making sure that when you're training for your job that you're doing, and it's a physical job so you do need to be training, what you need to do is work out what your physical advantages and disadvantages are and train appropriately. So rather than taking hours to do full body routines every day, what you need to think about is what are the areas of your body that you think you need to develop in order to successfully do the treatments that you're doing in the massage room. And some people are working 6 to 8 hours a day, so they would definitely be starting to become aware of whether it's their legs or their lower back or their core strength or their distal, like working through the hands. What parts of your body do you need to train? So when I started massaging, what I realised was that I needed to train my legs. I needed to get strong legs, because if I wasn't using my legs, I was actually not contracting my core, I was using my lower back. And I could see, I put a mirror in my massage room when I started, and I'd look across sometimes just to check my posture and to see how I was working. And what I realised was I wasn't using my legs enough. So my physical disadvantage was my legs. My physical advantage was my upper body strength. So at the end of this segment, have a think about what are your disadvantages, what are your advantages, and how would you tailor your training to make the most of that time that you have to prepare yourself for your job and also to have some longevity and enjoyment from the career that you're doing. Thank you.
Hi, I'm Kym Finch. I own and operate a remedial therapy business in Brisbane. I've been in the industry for 20 years, a little over 20 years now. And originally when I started looking at evolving and becoming into the industry, I'd always had a medical interest. As long as I can remember, even as a young child I had a medical interest. So I decided to start studying anatomy and physiology within a remedial therapy diploma. That was my starting point. When I started studying the diploma, to be honest with you, I don't even think I'd ever had a massage at that point. So it was a starting point, and I'd always been intrigued by muscle work and how it can affect the body. So that's how I started in the industry, looking at muscles, what we could do with them, what it could change, and that was my interest. I love the soft tissue work, love soft tissue therapy, and I got great results. I really, really enjoyed it, but I was very frustrated with the longevity, the outcome. So from that point, I decided to formulate my own therapy to see if I could rectify that situation so that we could get longer term results with the treatment that I was giving. So Finch therapy is, as I said, a neuromyofascial therapy. So we're looking at the central nervous system, we're looking at muscles, we're looking at the fascial connection and how it affects joints. So essentially it is a joint therapy. So it's a joint therapy but using a soft tissue approach. Most massage therapists, when they have someone in their treatment room, they're looking for very specific tight areas or restricted regions, which is fantastic. The problem with that is many of the tight muscles are adaptive changes as opposed to being a reactive or a primary cause. If you don't treat the primary cause, the likelihood of their condition recurring is pretty high. So I'm trying to, where possible, solve a problem so that their symptoms don't keep reoccurring. So what I've done over the years is I started looking at how I could incorporate a soft tissue approach with regards to joint mobility. When I was about 16 to 26, I used to get terrible thoracic pain to the point if I stood for longer than an hour, it would be so painful I'd actually have to lie down. You know, it's pathetic. There was nothing wrong. I had scans and x-rays. There was nothing structurally wrong. And at the time, the only available practitioner for me to see was a chiropractor. Fabulous. I always got great results. I always got pain relief. There was no doubting that. But the thing I did notice over the duration of 10 years of treatment, it was always very short-term results. I only got about 2 or 3 days relief, and then the symptoms would start to come back. So when I started studying anatomy and physiology, I looked at how I could incorporate a soft tissue treatment to change joint mobility in a way that could get long-term results. So I just looked at basic anatomy and physiology. You know, there's no joint in the body that can move actively without muscles contracting. It's just the way it is. You need a signal from the central nervous system to get a muscle to contract. So if the signal from the brain to the muscle is disrupted for whatever reason, the joints are affected as well. So I started my journey along the way, and I chose different muscles to see what changes I could make in the spine. And gluteus medius was one of the first ones that I started with, and I did everything I could. You know, I elbowed, I did the trigger point, I did the stretching, I did the strengthening, you know, I did the neuromuscular contractions that we do today. And each time I did something with gluteus medius, and this was over a period of time, I would assess the spine to see what changes had occurred. And it became very clear that when I did neuromuscular contractions with gluteus medius, it had a profound effect on increasing the mobility in the upper cervical joints. So back then I didn't really realise, or wasn't familiar with myofascial slings, and I wasn't sure of the concept and why it was actually happening. So I mapped lots of different muscles along the way, and it became quite clear that muscles were interacting with other muscles throughout the body, and I had this great mapping system of how this muscle would affect these muscles and affect these joints, and to date I've been able to identify every facet joint and pelvic stability as well, and trace it back to various muscles. And as I went on, and I realised that my mapping very much coincided with myofascial slings that were already out there, which was fantastic because it put a couple of the pieces of the puzzle together that I didn't have. It was an interesting concept because I knew that I could reverse the system, or reverse the protocol, if you like. Instead of just finding the tight, elevated muscles and painful muscles, I would go straight to the spine, identify which joints were stiff, and from the mapping that I had done, I could actually trace it back to a muscle that had the signal disrupted. What we did then was stimulate that signal. And the way we stimulate it by making a muscle contract in a really low grade contraction. So we contracted a muscle down here, it changed the joint movement up here. And all of those muscles, so myofascial sling being, you know, muscles that attach to other different muscles, all of those muscles, the tension changes as we change the tension of the one that lost the signal. You know, a scenario I like to use, and some of you youngies may not get this, but in the older houses, there was a light switch that it protruded out, a bit like a spinous process, not quite that big, but it protruded out. And it required a fair bit of effort to flick it down. If you got halfway, it did a bit of a zzz, zzz, made a bit of a noise, and the light would flicker, so you're getting some electricity through, some signal through, but it wasn't working properly. And I think the muscle's a bit like that too. You can still be getting some signal through, but it's not stabilising or functioning or doing what it should be doing. And as a result, that whole myofascial sling is affected as well, and the joints become stiff. Some of the benefits that clients receive in a Finch therapy treatment, because it is a neuromuscular treatment, so we're looking at stimulating the signal from the brain to the muscle, or central nervous system to the muscle, responses are really very fast. So changing a pelvic rotation, for instance, can happen in the same visit. Now, I know you can get that result doing other things as well, and certainly in my early stages of massage, I know I could do that, but sustaining it was a different thing. So to get the changes quickly, that's an important factor because it reduces their pain quickly. It gets them back being active quickly. I also I suggest that they do some neuromuscular contractions at home as a rehab process, because once the signal switches off, it actually takes a good month for the brain to start functioning by itself. So they need to do that at home for their own wellbeing and maintenance. One of the benefits for that is they don't need to see me daily or weekly to do that. They can do that at home. So it makes it very cost effective for them. Some of the other benefits are, as I said, decreased pain reduction, decreased muscle tone. So if you're massaging as well, it actually reduces the amount of effort that you need to apply as a practitioner. It increases joint flexibility. From an athletic perspective, it actually enhances athletic performance, because when a muscle isn't in its normal resting tone, it becomes inhibited, so they can lose power quite quickly. So it actually gets them back on track quite quickly to their peak level that they're capable of getting, or capable of trained for, that they have trained for quite quickly. Some of the most common conditions that walk in the door from a chronic pain perspective, I definitely treat a lot of lower back pain. It seems to be the flavour of the decade. Headaches, neck pain, they're really common scenarios. I think where Finch therapy excels is treating conditions that have had no injury. They've had pain for years, there's no pathology, there's no reason for them having pain, yet they can't get rid of it. I love solving puzzles, that's my big thing, and I love it when they come in and no one's been able to do it. That's where Finch therapy really excels. With regards to neck pain, headaches are a really common thing, and I have this story that certainly when I was developing Finch therapy in the early days, this gentleman came down from Mackay. He knew of someone that came to see me and he'd had headaches for 40 years. He was a 60-something-year-old gentleman. You could imagine having that type of headache daily. I'm talking daily. He'd had many suicide attempts. There were lots of problems going on. His problem was a very complex but yet simple problem to solve. He had some very specific joint stiffness that was very difficult to deal with. Because he was there for a short period of time, in Brisbane for a short period of time, we condensed the treatment, which we don't normally do, but I saw him, I think, about 4 times over a period of 3 weeks, which is a little bit unusual for me, but that's what we did. The first treatment, we had about 5 days between the first and the second one, and when he came back for the second one, so he'd normally have 5 headaches or 5 days of headaches, he'd actually had 2 days of headaches. And that was really exciting for me, and certainly very exciting for him. By the time I saw him next, he'd had 1 day of headache. So we hadn't solved the problem, but we're talking about a 40-year problem here that just in a couple of treatments we could reduce quite quickly. By the time he left back to Mackay, he'd had no headaches for a few days. And I didn't see him again, but I did phone him many months after just to see what was happening, and he had no headaches. So he was as happy as a pig in mud. So it all comes down to assessing, figuring out where you need to go, doing the orthopaedic testing and being very specific in your treatment protocol. And if you've got a pattern that, you know you're looking for this, you can go to there. It just makes it so streamlined, systematic and very easy to follow and use. Some of the other conditions are, I do treat a lot of plantar fasciitis, very successfully. It all comes down to being able to identify where it's coming from. And as I mentioned earlier, pelvic rotations is one of those main key features that is always there when there's plantar fasciitis. So it's just about loading, about unloading, trying to get their body in their most optimal position so that they can have a normal gait, to take some of the stress off the foot. Osgood slatters and severs, treat a lot of that. So getting kids or teenagers back onto the playing field where normally they have to stop for quite a long time. The teenagers that have presented to my clinic, they've always had one side, whether it's the foot or the knee, more painful than the others. So that's a absolute red flag for me to indicate that there is a pelvic rotation going on, and there always is. So we deal with that, find out which muscle is switched off, switch it on, pelvis goes back to its normal place. They do some neuromuscular contractions at home, which then deloads, if you like, the knee or the foot, whichever they're presenting with. And normally within a really short period of time, sometimes it's only a week, sometimes it's 2 or 3 weeks, they're back on the playing field. And it's great to be able to get the kids active, and it's usually the active kids that get it in the first place. Sciatica is a very common condition that comes into the clinic. Because I'm an end-of-the-road practitioner, meaning they've normally been everyone else before they come to see me, they've had their scans, they've had their x-rays and MRIs, whatever they're going to have. And the people that are coming to me generally don't have any disc pathology, yet they've got this searing pain down their leg. We have great success with that if you can identify the primary cause, why that nerve is irritated. And sure, the piriformis is an issue, but the piriformis is normally an adaptation to what's going on. So you still have to find out why that joint, if it's particularly the lower back joint, why that's stiff. It could actually be coming from a shoulder again. You need to do your very specific orthopaedic testing. Your rhomboid plays an enormous part when it comes to L5 stiffness or hypomobility. So thoracic testing tells me a lot of information as to whether that's associated or not, and whether we're going to be able to increase the mobility of L5. Lateral pelvic tilt is one of them. You know, lateral pelvic tilt or pelvic rotation. So any distortion of the pelvis plays an enormous part of irritating the nerve. Not to mention, talking about the rhomboid has a very significant effect fascially on the hamstring, the ITB. So you could have a multitude of things. You could have a pelvic rotation irritating the lower back joints, irritating the nerve. You could have that muscular component coming from the shoulder irritating it. It's just so easy to have a systematic approach. You do this, unlocks that. You do this next test, that's associated with that. That's also going to affect it. You just deload the area that could be possibly causing that irritation to the nerve. And to do that, it takes minutes. It really doesn't take long at all. Finch therapy modules, we run 4 modules. So we run them, over the years I have looked at different ways of running them to see how we could get the best possible outcome. It's 8 days in total for the 4 modules. We've split them up over 4 weekends, 1 weekend a month. So July, August, September, October, for instance. The reason we do that, I'm a bit of a stickler for not just blurting out the information and letting you go on your own and trying to figure it out. I really want, and I do achieve, to get you to learn and be able to utilise what you learn on that weekend and take home and use it. More importantly, I want you to be able to take home and use what we've learned, and by the time we see you next, in the next module, you've practiced and practiced and practiced, and you're actually ready to get to the next stage. You know, joint assessment and joint treatment is a new concept for a lot of massage therapists, and it's totally new, and you do need practice. It's very easy, but it takes a skill set that you haven't got at this stage, so you need to practice it. So that's why we've decided to do it a month apart at this stage anyway, so that you can practice before you move on to the next bit, and it is a really critical key. Once you do each module, you will be able to use all of the information that you've learned on the modules, and we do cover lateral pelvic tilt and how it influences on other joints, how to correct it, of course, pelvic rotations, leg length differences, thoracic rotations, rib assessment and mobility, certainly facet joint assessment as well is a very big part of all of the modules. And we'll be looking at specific treatment or specific conditions that may present to your clinic and how you can incorporate all of that information and treat them. So each module you'll be able to go the next day and implement what you've actually learnt that weekend. For further information on the workshops, if you visit finchtherapy.com.au, it has the course outline, it has the dates, it's got everything on there. It's got the registration forms. Just give us a yell if you need more information.
Hi, I'm Steve from Rock Tape. We're now going to show you a taping application for tennis elbow or lateral elbow pain. So if we measure the tape from just above the elbow to a little bit short of the wrist, we cut the tape, fold that over so we can round both corners at once. That means that the tape won't stick to bed sheets, clothing or towels, and we're also going to have a short little piece across the area of most symptoms. So we'll cut that and also round the corners. The next thing we need to do is put the muscles that we're taping on stretch. So if we have the elbow straight and we bend the wrist forward and even slightly into a little bit of pronation. We're going to start just above the elbow. So we tear the backing paper off the first bit of the tape. We apply that just above the lateral epicondyle, and then we're going to have light stretch on the tape as we apply it down over the extensor muscles and no stretch on the very end of the tape. While the wrist is still in this position, we can tear through the middle of the backing paper to do this decompression piece. A little bit of stretch, so if this is the area of most tightness, a little bit of stretch on this tape, place it down, no stretch on either end. And again, once the wrist comes back to a neutral position, we'll get recoil along the tape and take the symptoms away from this area.
Hi, this is Carrie from Recharge Class. I want to go over how you can change the weight and change the load on your treatment tools for each person. So as we know, when we're massaging someone, we might put less or more load, more weight behind us when we're treating them to create the change that we want for someone. And it's the same game for self-treatment stuff. We've got to be able to adjust, progress or regress how much load we want to put on their bodies. So say we're trying to use their glutes or for ourselves, then a simple and the most obvious one is just to sit down with the ball underneath. But this is a lot of my weight on this, right? Like I have my whole upper body and even half my leg weight is loading down into this ball, which depending on how sore my glutes might be, that could be a little bit overwhelming. So one way to reduce that would be to even lie down halfway all the way. So there's now far less weight that's being put directly on the ball. So then we can adjust just at the level that that person needs. There's other ways, so I can barely get up off the ball. There's other ways, of course, you can reduce this load, is if you're lying into the wall or changing how much forward weight or backward weight you're putting on it to really get just the amount that that person might need or not. Thanks.